Well, a lot has changed since the COVID-19 pandemic began, from the way we work, engage with others, and of course, how we fight this virus. The same is true for the front lines of this pandemic, our hospitals. Andy Weber is digging deeper into the treatments being used at hospitals here in central Illinois to help the most critically ill patients.
COVID-19 is a novel virus, meaning it's new, and when it struck the United States, everyone, including healthcare professionals, had to adjust and adjust quickly.
Initially, a lot of things were unknown about the disease, so it was about getting together protocols and making sure that the workplace was safe for nurses, physicians, and other healthcare staff. And that was what our energies were spent on the first several weeks.
Dr. Praveen Sohindra is an infectious disease and critical care physician with Unity Point Health. Sohindra says once they're able to ensure they could operate safely, attention turned to combating the virus and helping patients suffering severe symptoms.
We started focusing more on different management issues, what medications work, what treatments work, and what may not. And I think we've had a slightly better idea now, several months into this, about what probably works and what doesn't.
Over the last few months, several different treatments have been used to help either fight the virus or reduce the symptoms experienced by patients who were hospitalized. Today, Unity Point and OSF Healthcare use similar treatments. When someone is hospitalized, it's usually because they're struggling to breathe. In addition to oxygen, one of the medications that's frequently tried first is dexamethasone, a steroid. Dr. Steve Hippler, Chief Clinical Officer with OSF Healthcare, says steroids can be used to reduce the symptoms caused by a person's immune system responding to the virus.
Steroids are the one that I believe have the best data from the best studies.
So a lot of people respond to the steroid response. They have a great response because of the inflammation. So it actually does what it's supposed to do.
While steroids are designed to reduce symptoms caused by an intense immune response, other drugs are used to directly combat the virus, including remdesivir. Dr. Michael Cruz is Chief Operating Officer at OSF Healthcare.
Remdesivir is a medication that we're currently using today, which really slows the replication of the virus once it's in you. So we have to make the diagnosis, you have to meet certain criteria, and then we would have that available.
Another treatment being used by area hospitals is convalescent plasma transfusions. In this treatment, plasma of those who have been infected with the virus is given to those still fighting the virus.
So we have been using convalescent plasma for the last few months. Again, it's a therapeutic modality that's believed to have direct effect against the virus itself. So the earlier we use it, probably the better.
One thing that all the doctors stress was that none of these treatments are a guarantee. Some have proven more effective than others, such as steroids, but right now a lot of these treatments are classified as experimental. The good thing is the risk to patients is very low. Every patient's treatment can look different and involves continuous conversation between patient and physician. For 25 News, I'm Andy Weber.